Have you ever wondered why your feet are burning, tingling, or just feeling numb? Has someone told you that medication is your only option to treat this? Well, keep watching this video if you want some more information and some answers. Welcome to Suite 250 at Cool Springs Foot Care. My name is Dr. Lance Reeves, and today I wanted to talk about peripheral neuropathy. Especially since November is World Diabetes Month, I wanted to highlight a pathology that affects a lot of people struggling with diabetes. Peripheral neuropathy is damage to the nerves in the hands or the feet. This can present in many different ways and has a lot of different causes. This can make things more difficult when trying to pinpoint the exact cause and finding the best route of treatment for you. But I'm hoping this video can give you some sort of direction or information to help with the treatment of your peripheral neuropathy. When looking at a patient's condition, it's important to get a thorough physical exam and test each and every nerve that may be causing the pain. Because if only one nerve is causing the pain, that's a much different treatment course as opposed to someone who's having pain around all their nerves. When looking specifically below the knee, it's important to address the common peroneal nerve, the tibial nerve, and the saphenous nerve. However, as you get further down the leg, different nerves branch out into smaller nerves that cover the entire foot on the top and the bottom. This is why getting a full comprehensive physical exam is so important, because you need to address and identify which nerves are causing you some of those problems. Without this full comprehensive exam, certain things could be missed and it could prolong you getting the correct diagnosis. This is why it's important when you're seeking help from a doctor that they do a full comprehensive physical exam for you. Peripheral neuropathy can present in many different ways, and this is again why it can be such a struggle to pinpoint exactly what's going on. For some patients, it just starts with a funny feeling in their feet. They'll come in saying that it feels a little different when I walk. It's not necessarily painful, but it's a little bit annoying. Other times this will present as a tingling sensation. Patients may say it feels like their foot is asleep on and off throughout the day. Again, this might not be painful for the patient, but it's certainly going to be annoying or frustrating if they're having this sensation throughout their daily life. Other times this can be painful, and patients can describe it as painful burning, shooting, stabbing, electrical sensation within their feet. This is when patients really start to struggle. If you are having constant burning, pain, electrical sensation in your feet, you should seek help right away. Sometimes this can prevent patients from walking, performing daily activities, or even sleeping, which can really affect their day-to-day life. There are many things that can cause peripheral neuropathy. Some of the more common ones are diabetes, history of chemotherapy treatment, and alcoholism. Other causes of peripheral neuropathy can be an autoimmune disorder, exposure to toxins, previous injury, or even a vitamin deficiency. When determining the treatment route for peripheral neuropathy, not only is it important to get a thorough physical exam, but also a thorough history. If someone is not taking the adequate time to get a full history and physical, then certain things could be missed, which again could prolong the diagnosis or the correct treatment for the patient. This to me is one of the things that makes treating peripheral neuropathy so difficult, is that there are so many factors involved that it takes a lot of time to figure out exactly what's going on and what's the best route of treatment for each specific patient. Unfortunately, if one of these things is missed and it prolongs the correct treatment, that can lead to a very frustrated patient because they're not getting the best care. In patients with diabetes, the first and frontline treatment for them is to control their blood glucose levels. If a patient has really high blood sugars, that is going to make treating their peripheral neuropathy much more difficult. High blood glucose in the bloodstream can cause a lot of problems and have a very negative effect on peripheral nerves. The second thing to consider is a vitamin deficiency, specifically in patients taking medication for diabetes. Certain medications can actually cause malabsorption of vitamins. This means that a medication that is helping with their diabetes management can actually cause a vitamin deficiency and enhance or lead to peripheral neuropathy. Again, I cannot stress enough how important it is to get that comprehensive history and physical exam, because if someone is not taking the time you deserve, certain things can be missed and it can prolong the best treatment for you. So a lot of times treatment for peripheral neuropathy is focused on getting your blood glucose under control and getting vitamin supplementation. Other times a topical pain solution can be helpful for patients. In my experience, it's pretty trial and error, meaning some of them work really well and some of them don't work at all. But I like to tell patients, if you're able and willing, let's go through several topicals to see if that can help with the pain. In more severe cases, oral medication can be beneficial for patients with peripheral neuropathy. But again, if you're going to be taking any medication, it's important to think through all of the pros and potential cons of that medications. because certain medications can have pretty severe side effects. Oral medication can be a great option for patients, but I typically try to avoid any oral medication if I can. There are surgical procedures that can help with painful peripheral neuropathy. However, I cannot stress how important it is to get that really thorough history and physical exam, because if this is not done correctly, surgery can have a lot of complications. And I would hate for you to go through a surgery if there was a non-invasive, more conservative route that could have been helpful for you. Personally, I always try to do as much as I can non-invasive and non-surgical before patients are in need of a surgical operation. In my office, I wanted to offer patients a non-invasive, pain-free, non-surgical option to help treat their peripheral neuropathy. We have an MLS Laser Therapy. This works on 2 wavelengths to help decrease pain and decrease inflammation. This also helps increase blood flow to the nerves. With an increase in blood flow, that helps increase oxygen and can help heal and reduce the pain around those nerves. This is a great tool for patients who have tried and failed other topical options and are hoping to avoid any potential surgical intervention, or if they're trying to avoid oral medication. Again, it's important though to get that really thorough history and physical exam to determine the best route for you. This treatment is a non-invasive, non-surgical, requires no medication, and can be a great tool for patients if you're a candidate. If you have any questions regarding peripheral neuropathy, or feel like you may be a candidate for MLS Laser Therapy, call our office today at 615-567-5622 or visit us online at coolspringsfootcare.com. Thank you so much for watching this video. If you found it helpful, please like, comment, and subscribe to our channel.